So what is international health per se? Now see, international health refers to the study of health and diseases across national borders. So as you see in this world of ours, fortunately it is much easier teaching this topic to you because you all have grown through the COVID-19 pandemic, isn't it? You have seen that how due to globalization and due to travel, due to ports and airports, diseases no longer remain problems of certain countries or certain populations. Before, the West used to think, okay, a problem of Nigeria will be a problem of Nigeria. We need not worry about it, right? We could think in India that, okay, some problem that is happening in Pakistan may be a problem of Pakistan, we need not worry about it. But those days are gone, okay, due to the, not just, so even if you impose, you say we'll impose travel restrictions. Even if you impose travel restrictions, there's a lot of trade that is happening. There's a lot of substances which are being manufactured, which are transported from one country to another country on a regular basis. And those substances can also act as fomites, isn't it? They can contain infectious particles from which diseases can spread. So we are in an age of globalization where due to A, exchange of people, B, exchange of animals, and C, exchange of trade materials, the diseases, especially infectious diseases, can move very fast from one country to another country. So international health basically deals with infectious diseases. It deals per se, in your purview, it deals with infectious diseases that can spread from country to country. While there are even broader domains of international health, when we talk of international health, we even should include the ideas of international cooperation, where if one country is developing a vaccine, it sends it to the other countries. If one country is developing a medication or an advanced research drug, then it shares that with the other countries. So we are living in an age of global cooperation, and international health is one of the very important topics of public health concern like that. So commonly before, not so commonly now, but before you used to be, it was a trend that you were given short notes about various international organizations. Okay. So when we talk of international organizations that are concerned with the help of countries, we are concerned with three types of organizations. Okay. First type of organizations are organizations which are agencies of the United Nations. We know that United Nations is a collaboration between various independent international countries who have come together and formulated the agencies to take part in global cooperation. So there are some agencies of the United Nations. First and foremost, we all know about them. It is World Health Organization, isn't it? So WHO by its name only is related directly to health and is the most important international organization of the UN that you need to be aware of. Other than that, we have UNICEF, isn't it? The United Nations Children Education Fund, isn't it? They are working not only for children education but also for children nutrition as well as for prevention and management of childhood illnesses. Okay. So UNICEF has got a very good, very important role when we are concerned with maternal and child health globally, right? Then we have UNFPA. UNFPA is concerned with, as you know from the term only, it is concerned with reproductive health. Okay. Other than this, you also have various United Nations agencies, the UNDP, the United Nations Development Fund. Okay. UNDP also has an important role as it organizes the funds which come into health. But there are various other organizations also, global entities, which are not agencies of the UN per se, but still they play an important role in health. For example, the CDC is an organization of the United Nations, United States of America, isn't it? It's an organization of US. But the CDC you see, America is a country which is having global interactions and travel with most of the countries across the world. We are all trading in dollar. So America at the same time is vulnerable to diseases occurring from any country of the world. So the CDC plays an important role in collaborating with various countries for the sake of international health. Next, World Bank. We know that World Bank is the greatest body which is having all of the power to lend. Okay. So whenever we are thinking, so for international health, we will see as we go forward that every country needs some infrastructure. They need some ability to be detecting the new diseases that are emerging, problems that are present in the populations, to be reporting that problems to the WHO's framework so that the global preparedness can be there in stage, right? So for that purpose, you will require funds. You will require funds mostly for the countries of the third world and for underdeveloped countries, right? So there the World Bank plays a very, very important role. Other than this, there are some non-governmental international organizations like Medicine Sans Frontiers. In India, Doctors Without Borders. Okay, so they are working in various names in different parts of the world. Then you have Save the Children. Okay, you have Red Cross. You have JPEGO. There are various organizations which are working in public health. Okay, some are multilateral. Multilateral means when multiple countries are there as the funding agencies of those organizations. Some are bilateral. Okay, suppose we have suppose DFID. DFID is an organization that is part of the UK government, which is working for development in India. Okay, like this, these are bilateral. Okay, or PAHO. Okay, it's a Pan-American Health Organization. So there are some organizations which are bilateral, which is one country's aid to another country. Okay, and there are some organizations which are multilateral. Okay, and there are some organizations which are there in India also. In India also there are some non-governmental organizations which are working. Okay. So you need to be aware a little bit about these organizations. Okay, various organizations, the UN agencies organizations, the non-UN international organizations, the bilateral and multilateral organizations, and voluntary health agencies. Okay, just be oriented to what are the organizations, what are the roles they play, what objectives they fulfill, right? So going ahead, how did this concept of international health gradually come in? Okay, as I said that the international health concept comes from the occurrence of various pandemics. Okay, now what is a pandemic? Can anyone tell me what is a pandemic? What is a pandemic? A pandemic is it is an epidemic occurring globally. Then what is an epidemic? It is the occurrence of a particular disease in a specific geographic area over a specific period of time, clearly in excess of expected frequency. That means there is a disease. Now in a particular geographical area, in a particular time of the year or in a particular time, I have an expected frequency of that disease. If the disease suddenly appears at a greater frequency, then we think that okay, a epidemic has occurred. Now if such an epidemic moves across the world or keeps the potential to move across the world, then we call such a epidemic as pandemic. Okay. Now somewhere we are gradually transgressing from terms of pandemics and epidemics into a public health emergency of international concern, and we will discuss as we go through this presentation that what is a public health emergency of international concern. So pandemics are large scale outbreaks of infectious diseases that can greatly increase the morbidity and mortality over wide geographic areas and cause significant economic, social and political disruption. Understand that any global initiative becomes a global initiative only there is a lot of economic disruption. Okay, other countries will come and think about different countries. One country will think about another country only when that country is also somehow in risk of economic disruption due to that. Okay, as we see even in the war that is currently going on between the US and Iran, India is concerned only because it is having some economic consequences out of that war. If we were not having economic consequences out of that war, we would not be bothered. Okay, so the main concern about these pandemics of these diseases of international spread is that they directly do or they have the potential to do economic disruption, right? So if we look at what are the common pandemics that have been occurring over the ages, the first name that comes to mind is plague, isn't it? You know that right from the medieval ages we have had various outbreaks of plague. In the Middle Ages, the Justinian plague, Black Death, and again various plagues. So Justinian plague that occurred in the times of the Byzantine Empire, isn't it? Next you go ahead, you come to the much later ages, the Black Death, the main pandemic of plague about which all of the history is written. If you have seen that Netflix series on the Medicis, has anyone seen? Lorenzo de Medici, the Medici family. You have not seen. Okay. So during the Middle Ages, at the times when they were flourishing, those port cities of the Middle East, they were devastated by plague. And how did it come in? It came in through ships. It came in from rats which were inhabiting the ships which were coming into the harbors of those ports. Okay, and it brought those prosperous cities to their knees, literally, because they were not able. Those are times where even the bacteria microbe had not yet been discovered. So people were clueless as to how the disease was spreading, right? Next, other than plague, you had cholera, right? Several pandemics, year after year after year. The latest cholera pandemic that was occurring across the world was the cholera pandemic due to the L-Thor variant of the Vibrio cholerae, isn't it? You know the famous story of Jon Snow, how he does that shoe leather epidemiological research of looking into London, which hand pumps were cholera diseases were clustered around which hand pumps he found out, and that is the beginning, as we know, of the modern subject of epidemiology as we know it, isn't it? So one pandemic was plague, then cholera. Another pandemic was influenza. We all, during COVID-19, we all learnt about the history of Spanish flu, isn't it? Spanish flu 1918, 1919 killed numerous number of people. Okay, again due to Spanish flu was basically due to influenza, isn't it? So as you see, various pandemics have occurred due to, as we know, the influenza virus, it undergoes shifts and drifts, isn't it? The virus keeps changing, and it is due to the shifts, not the drifts. The drifts cause continuous outbreaks. The shifts cause pandemic. Okay, so initially we had a pandemic of Spanish flu that was due to H1N1. Then you had Asian flu due to H2N2, and gradually then you had the H3N2, right? So you keep having those pandemics. And what we learned from influenza, one interesting thing is that many a times what happens, the virus gradually gets changed. And as the virus gets changed, the immune response to the changed virus also changes. But the actual original virus might be circulating in the wild. And all of a sudden that virus can come back and create a pandemic. Okay, that is not a new virus, it's the old virus which the immune system has forgotten due to the drifts that were occurring in the community. Okay, so like these various pandemics have kept occurring. The three most common diseases implicated were plague, cholera and influenza. Why this is important, we'll come to it gradually. Okay, so plague, cholera and influenza were the three diseases causing the most common pandemics in the history, isn't it? So in this background, finally we came to COVID, isn't it? And in COVID, we saw that COVID had three phases. There was a first phase, there was a second phase, and there was a third phase. So under this background, we will have to study about the international health regulations. Why have the international health regulations come? The international health regulations have come so that we understand how to tackle the pandemics in a coordinated way through concerted global efforts. Okay, so that a disease that is, because for any disease to become a pandemic, it must first originate somewhere and then it goes through undetected or unhindered spread and then it causes a pandemic. But if every country is always on the lookout for new diseases, for diseases which could lead to pandemics, then we will essentially be able to prevent pandemics, right? So under that background, the international health regulations were framed. The international health regulations first were framed in the 1950s. Now they were modified, and the latest international health regulations that we are having are the international health regulations of 2005, which were adopted in 2007, right? So what are international health regulations? The regulations provide a unique public health framework. So these are a framework. What is a framework? A framework is a set of rules, laws and regulations. Okay. So it is a public health framework in the form of obligations and recommendations. So there are some things that people must follow. So every person who signs that regulation it becomes an obligation on their part to follow these provisions. And there are some recommendations, that some things that they should do. Okay, so some things they must do and some things they should do. Okay, so it provides a unique public health framework in the form of obligations and recommendations that enables countries to prevent, prepare for and respond to public health events and emergencies of potential international concern. Every word is important. So, to the public health events and emergencies. So sometimes it might be a disease, sometimes it might not be a disease. It might be a nuclear reactor leak. It might be a toxic chemical spill in the ocean, right? It might be the leak of some bioterrorism agent, right? It might be the release of some spores. It may not always be an infectious disease. So, it could be a public health event or emergency of potential international concern. We will not just wait for the international concern to develop. If we think that there is potential, then the international health regulations become applicable there. Okay. So, not always do we need a PHEIC or a public health emergency of international concern to be established for international health regulations to be adopted. International health regulations need to be adopted whenever there is even a threat of a disease causing international spread, right? So, presently there are 196 member states of the WHO who have signed the IHR of 2005, right? And India definitely is one of the signing authorities. So, as we have discussed that what is the need of having this international health regulations. So, we have already discussed that one is globalization, that is trade, cross-border movement of humans and cross-border movement of commodities. Secondly is new pathogens. Okay. So, as we know COVID-19 is not a pathogen that was there before. Coronaviruses were there, but COVID per se, COVID-19 was a new pathogen. It was a pathogen that we had not previously seen or known about. So, what is the problem when a new pathogen comes? When a new pathogen comes, we do not have any data on the natural history or the epidemiology of that disease. We do not know how this disease transmits. We do not know what consequences it leads to. We remember that in the initial phases of COVID-19, if you remember, that people in Italy, they were having a movement that why subject Chinese people to discrimination, and they started hugging them. There was a movement, social media campaign that went on in Italy, where they were, whenever they found someone Chinese, they were going and hugging them because they thought that this COVID-19 stigma was a hoax. And then Italy served the worst consequences of the first COVID wave, isn't it? So, the problem occurs because we do not know, at that time it was not, we were not sure that how COVID-19 transmits. Does it transmit by direct contact? Does it transmit by sexual contact? Does it transmit by, say, fomites? Does it transmit by airborne transmission? We were not knowing. So, mistakes happen, right? Next, re-emergence of infectious diseases. So, as we know, there are some diseases that we have removed. Smallpox, we have eradicated, but the smallpox pathogen is still there with various countries. The smallpox vaccine also in small amounts is still there with all countries. Now, what if one country decides that I will wage a war with smallpox, right? So, we always run a risk of re-emergence of pathogens. Or for example, you might think that polio has been more or less controlled, isn't it? Only 1 or 2 countries are still having wild polio virus cases. But what might happen is some country can alter the polio virus slightly, or the polio virus itself can undergo some, we know that every organism undergoes natural selection when we are giving them pressure of survival, isn't it? They undergo natural selection, and a severe strain might be selected and you can have a re-emerging disease of that particular virus. For bacteria also, we have been treating bacteria efficiently with antibiotics, but with every passing decade, the bacteria are growing more and more resistant to the standard antibiotics that we keep using. So, a previously very well controlled bacterial disease now might come back again because it is resistant to antimicrobial pathogens. Okay. So, under the under the threat of these three major things, new pathogens, that is emerging diseases, re-emerging diseases and globalization, there was a need to formulate the international health regulations. Okay. So if you look at the historical background, the first international sanitary conference, those are times when microbes have still not been discovered. Okay. So the only idea was sanitation prevents these diseases. The sanitation barrier, we did not know what causes this disease, but we knew that if we have sanitation, then these diseases go down, isn't it? So the first sanitary conference was held in 1851. As we know, the WHO was constituted as early as in 1948, and by 1969 you had the first set of international health regulations, isn't it? The international health regulations were amended in 1973 and 1981, and in 1995 there was a call for revision of the IHR, and finally in 2005 the IHR was revised and it was adopted in 2007 in the 58th Assembly of the World Health Organization. Okay. So it came into effect from 15th June 2007, the IHR of 2005. It's the IHR of 2005, but it came into force from 2007. Okay. So what is IHR then? It is a international health regulations, is a legally binding instruction. Okay. And its goal, as we have already discussed, is to prevent, protect and prepare for prevention of diseases that can potentially spread across countries and continents. Okay. The core objective is maximization of public health security against the international spread of diseases. And how will it achieve? It will achieve this by two things. One is, as I was saying, strengthening of national public health infrastructure. Every country needs to have enough public health infrastructure so that it is able to look for diseases which can potentially spread to international countries. And secondly, we must have a global connected network. So every country detects its own diseases, and we have a global network that the moment the country detects a disease, it reports it and it gets interconnected in the global network. Okay. So the international health regulations will achieve the public health security through two things. One is strengthening of national public health infrastructure, and secondly a coordinated global communication system, isn't it? So IHR 1969 to 2005, there was a change. What was the change? There were three changes. The first change was the IHR 1969 was concerned mainly with three diseases: plague, cholera and yellow fever. Okay. Coming to 2005 IHR, it included all diseases. It included any disease which has the potential for international spread. So this was the first change. The second change was from preset measure to tailored response. Before, there was a set thing that okay, if this occurs, this will have to be done. Now, every time a PHEIC is detected, the WHO constitutes a committee, and that committee decides what to do based on the threat. Because see, before we had only three diseases, so we knew what to do if any of those outbreaks was occurring. But now we have anything that can have a potential to cause international spread. So if it's a nuclear disaster, it requires one kind of preparedness. If it's a chemical spill, it requires one kind of preparedness. So there is no preset guideline that this is what exactly has to be done. It's a tailored response based upon which threat has been reported from which part of the world, isn't it? Next is from control of borders to containment at source. Before, the objective was okay, if one outbreak has occurred, shut that country. Do not travel to that country, do not let travelers come out of that country. Okay. But that is almost like a punitive measure on that country. Why will a country report a disease outbreak in itself if the moment it reports that, what you do is seal that country? Isn't it? So now the IHR is no longer punitive. It looks for containment at source, that the moment you find such an outbreak, the country's responsibility is reporting. Then it is the responsibility of the collected global agencies to try and contain that outbreak. Okay. So essentially going against what Trump did during the COVID-19 thing. Okay. So going ahead, what is the purpose and scope? So as I was saying that from 3 diseases we have now moved to a all risk or all disease approach, in which we include communicable diseases, which are infectious diseases. We include biological risk, bioterrorism agents. Bioterrorism agents need not always be spores of infectious diseases. They can also be chemical weapons, isn't it? Gases. Some chemical compounds, if spread from the flight, will cause mass destruction of crops or mass destruction of animals and people. So bioterrorism agents. Chemical risks as in toxic spills. There is an industry. We all know about the Bhopal gas tragedy, isn't it? So like that, chemical spills can occur in the high seas, in the oceans. So they need to be mitigated. And also radionuclear risks. Many countries are using nuclear power for power generation, isn't it? So there also, if there is a leak, a radiator leak, like after the tsunami there was leak in one of Japan's reactors, isn't it? We all know about the Chernobyl incident, isn't it? So these are nuclear radiator risks. So if such a leak occurs, the radiation storms can impact many countries which are there in and around those countries. Okay. So all of these risks will now come under IHR. So that is the scope of the things that will be looked into. And the objective is ultimately so that it does not interfere with international trade and traffic, isn't it? So that the economic impacts can be mitigated. So suppose like India is one of the signatories to the IHR 2005. So for a signatory to the IHR, what are the obligations that that country must do, isn't it? So what are the obligations? First and foremost is designation of a national focal point. For example, there is an outbreak in India. Then WHO will contact with whom? Who is responsible for an outbreak in India? So in India, the agency is NCDC, the National Center for Disease Control. Okay. So whenever an outbreak occurs, WHO will contact with the India's focal point at NCDC, isn't it? So like this, every country will have to establish a focal point of its own. Okay. Next, legal and administrative framework. So if we are going to have something that the country will obey, so the laws of the IHR have to be also there in the laws of the country. So the constitutional framework of the country have to make a provision for the laws of the IHR to be included in them, right? Next, comply with the provisions round the clock. So the IHR focal point has to be active 24/7. Someone has to be there. The mechanisms have to be in place round the clock. There is no holidays, no off days, right? Next, assess events and notify potential PHEIC. That whenever there is an outbreak, every outbreak that is reported needs to be assessed. Needs to be assessed by a set guidelines which we will discuss going ahead. And based on that guidelines, the country will have to decide whether it is a potential public health emergency of international concern or not, and report to the concerned agencies accordingly, right? And finally, the countries has to develop some core capacities to be able to prevent, detect and respond to such outbreaks. Okay. So A, it has to have a focal point. B, it has to have the legal provisions to be included in the constitution. C, the focal point and the provisions have to be activated 24/7. 5, it has to have the ability to detect and report every PHEIC, and for that the country has to build some core capacities within itself. So what are the core capacities? The core capacities are such that the country is able to detect and investigate events, report them, respond to them when they are occurring inside. So if they are occurring inside, the country will be able to detect and investigate them, then report them and to respond to them. But what if something is happening outside? Then how will it enter the country? How will something from the outside enter the country? It will enter either through the airports or through the seaports or through the land borders. So the country will have to have some checks and balance mechanisms at each of the points of entry, that is the airports, the seaports and the land borders. Okay. So these are the 4 areas where core capacities have to be built. First is detection and investigation of anything inside, next ability to report that, and third ability to respond to that internally. And if there is something that is there on the outside, then we must have the checks and balances in our portals of entry, that is at the airports, seaports and land ports, to be able to prevent the entry of that disease or that problem into our country, right? And what is WHO's role? WHO's role is to keep the global monitoring continuously functioning. That every country will play its role, but there has to be a global agency that links all of the countries and takes care of the reporting and everything. That part will be paid by the WHO. Next, surveillance. Okay, it will take part in surveillance. Surveillance means whenever it is getting an, what is surveillance in one word? It is information for action. Just collecting data is not surveillance. Doing some response with the data that is collected is surveillance. Okay, so WHO will connect all of the agencies and they will take the necessary measures to tackle it. That is first role. Next, all of these countries will develop their capacities. How will they have the resources? So WHO will provide with the technical expertise for the countries to be able to develop their internal capacities. WHO will declare a PHC. Countries will detect and inform the WHO whether it is a PHEIC or not. That declaration will be by the WHO. Can any of you tell me which is the latest PHEIC that has been declared? The latest PHEIC? No. Ebola. Currently the Ebola outbreak that is going on, you know that it is a very different Ebola outbreak that is going on. Previously Ebola was characterized by a very high mortality rate. So what happened, people who got sick, they got sick so severely that they were there inside their homes only, and that prevented Ebola from spreading widely. But now in the latest Ebola outbreak, the people are initially suffering a milder course of the disease, and that is creating a problem because that is leading to more transmission of the disease. Okay, so this time we are facing a unique challenge with the Ebola outbreaks, and the current Ebola outbreak has been declared a public health emergency of international concern. Okay. Now so much talk about PHEIC, public health emergency of international concern. What is it essentially? So a public health emergency of international concern is an extraordinary event which is determined 2 things. If it constitutes a public health risk to other member states through international spread, or if it potentially requires coordinated international response to tackle it. Okay. So either of 2 things, if a disease is spreading which has the potential to cause economic disruption, trade disruption internationally, or if it is such that it may require international communities to participate in its mitigation and control, then it constitutes a public health emergency of international concern. Okay. Now what are the diseases which are public health emergency of international concern? So whenever we have to call a disease a public health emergency of international concern, it will go through some steps. As we have already discussed, that suppose some outbreak, suppose a single human occurring at a like working in a poultry farm in our country, say in Birbhum, gets infected with bird flu. The moment he gets infected, first thing that has to be done is detection. the doctor to whom he goes needs to detect that okay, this could be bird flu. Next, verification, that person's swab and secretions will have to be sent for PCR and confirm that okay, this is bird flu only, this is not the routine influenza that is occurring, right? And once we have detected and verified, then we have to assess the risk, that what strain is this, how many people could be exposed to this person, how many of them have already travelled here and there, what is the course of the disease in this person. Okay, so can this disease spread internationally and cause trade disruption, or can this disease require international community to come and support us in controlling it? And based on this we will report it, and based on this the decision will be taken whether it is a PHEIC or not, isn't it? So what happens usually before the public health system detects, many a times it is the media who reports, okay, because unlike the government's public health infrastructure, the media is continuously there trying to find out things to report, isn't it? So many a times what happens, suppose an outbreak of a disease is occurring in Congo, or an outbreak of a disease is occurring in Thailand, then even before the country is able to detect, the country will be concerned only after something happens. It takes a little bit of inertia for a government to be able to find out and detect, and because there are diverse countries and the countries have different terrains, it's not always possible for governments to detect them first. So usually the first reports are a media report that has come from a local channel that one such disease outbreak has occurred. So immediately what the WHO does is, the WHO sends that media report to the IHR focal point of that country and asks them that this is a report, you go and verify and report to us within 24 hours. Okay. So this is the verification process that usually goes on. Okay. And many a times if the country is not able to verify, then the WHO will send an on-site team to go there and to do this verification. Okay. So any event that may constitute a public health emergency of international concerns requires to be notified within 24 hours, okay, to the WHO. Now what are the diseases? There are some diseases where even a single case constitutes as a public health emergency of international concern. What are they? Smallpox, polio, human influenza and SARS, severe acute respiratory syndrome. So in these four diseases, even a single case, influenza routinely to influenza is occurring, but if a new strain has come, okay, so continuously there is serosurveillance that is done for influenza. Among the people reporting influenza, few people are subjected to PCR to look at whether the strain is the common strain or a new strain has come up. Okay, so even a single case of smallpox, polio, SARS or a new strain of influenza constitutes a PHEIC. Other than that, these diseases or different diseases of regional concern may also constitute PHEIC, but for that we have to refer to a decision instrument. The international health regulations have provided a decision instrument. Countries need to look at that decision instrument and decide whether the other diseases constitute a PHEIC or not. Okay. So what do we look at? We look at, is the public health impact of the event serious, means whether it can spread to masses, whether it can cause significant amount of mortality or morbidity, isn't it? Is the event unusual or unexpected? Because there are many diseases which are routine. If it's endemic, many endemic diseases cause a lot of mortality and morbidity, but they do not constitute a PHEIC. So whether it is serious and whether it is unusual or unexpected, as we were saying for the definition of epidemic itself. If it is clearly in excess of the expected frequency, then only we say that it is epidemic, isn't it? Is there a significant risk of international spread? And is there a significant risk of international travel and trade restrictions? So if any two of these four criteria are satisfied, then the disease constitutes a PHEIC. Okay. So for those four diseases, polio, smallpox, human influenza by a new strain and SARS, for those four diseases, any case it's a PHEIC. For other diseases, if any two of these four criteria are satisfied, then it can constitute a potential PHEIC. Okay. So there is a decision instrument like this which we ask, and if any two are yes, then it constitutes a PHEIC and necessary measures need to be taken, right. So again, talking about the recent PHEICs that are occurring, we know that COVID-19 we are all aware of, isn't it? From 2020 to 2023, we had essentially 3 big waves. The last was the Omicron variant, isn't it? Monkeypox, we saw localized outbreaks, but it was not a disease that caused a huge amount of spread, isn't it? Because the spread was through close skin to skin or sexual contact. That is why the disease did not spread like it spread in the case of COVID, isn't it? Then polio, as we know, polio is still on because of the 2 countries where it has still not been completely eliminated, isn't it? And latest is Ebola, isn't it? Ebola, time to time it has caused outbreaks, but the latest one of 2026 has been declared as a public health emergency of international concern. Okay. So this is all about international health. So what did we learn? We learned that what is international health? We learned that there are some organizations that we need to know about. Okay. WHO, UNICEF, Red Cross. Okay. These are favorite questions. These have been asked repeatedly. What is their role? How many regions? What they do when they were constituted? What is their importance? So read a little bit about them. That's entirely things that you have to mug up, so I have not dealt in detail with them. Next, international health regulations, why they are in place, what is their role, what is a public health emergency of international concern. Okay. So I hope you have understood so far. If there are any questions so far, please go ahead. So what are the nearest portals of entry from here that you can go to? We have land borders, okay, in the entire Bangladesh border, there are several places where you have land border organizations, okay, LBOs, and there in the land border organizations, there are public health units, okay. There is a public health specialist who is stationed there, who does, who looks at people, any disease, quarantining people, isolating people based on suspicion, all of that is done, okay. If you go to the Kolkata airport also, there is the Airport Health Organization, APHO is there in Kolkata airport, okay. If you go to, Khidirpur port, okay, in Kolkata, dock, in port also there is a Port Health Organization, okay, where they look for, routinely they look for, all kinds of screening for diseases, there are various documentation that flights, ships, they have to maintain, okay, regarding fumigation, regarding, isolation of people reporting any symptoms, regarding sanitization of their facilities and everything. And all of those documents have to be checked by the port, airport and land border organizations. So if you have time, you can go and look into them, study about them. It's a very interesting area, okay. And doctors do it, okay. Doctors, they do it. Next, going ahead to travel medicine, okay. In very short, I'll talk about travel medicine. Why discuss this together with this is because this is the exact opposite side of what we were discussing so far. We were discussing about how countries should be careful about diseases that can be transmitted through travelers, isn't it? And in travel medicine, Emporiatrics, we are concerned with how travelers need to be concerned while they are traveling to different diseases, because before they bring that disease into another country, first they will themselves get infected. So if a traveler, suppose you are a traveler from India and you are going into sub-Saharan Africa, then you can be suffering from yellow fever, isn't it? Many people from various countries go to the Middle East in Mecca, for religious pilgrimage, there is a very common outbreak of meningitis that is associated with that area. Okay. So from time to time there are various outbreaks that are prevalent in various parts of the world. We know, that we in India are a receptive country for yellow fever. Why? What is the vector for yellow fever? The vector for yellow fever is mosquito, Aedes aegypti. Okay, it's the same dengue mosquito which is the vector for yellow fever. So we have everything for yellow fever. We have the mosquito, we have the climate for the mosquito, we have the people. We just don't have the pathogen, thankfully. Okay, so we need to be very, very careful about yellow fever specifically. If it comes at once, it will create a epidemic across the country, because the entire country has not suffered from yellow fever because the pathogen is not there. So we need to be extremely cautious about this. So Emporiatrics is basically the study of travelers' health. Okay, it comes from the Greek word emporos, meaning traveler, and medicine. Okay, so it's a branch of medicine that deals with pre-travel advice and prevention and management of medical problems encountered by specifically international travelers. Okay. So the objective is to keep the travelers healthy by giving them appropriate preventive advice, giving them prophylaxis, and giving them vaccination. Okay, so that they do not suffer from illnesses that are specific to countries. Okay. So if you look at what are the illnesses that commonly occur in travelers, we all know that infectious diseases are a problem. Okay, you see that infectious diseases major contributes of illness, and 1 to 4% of deaths among travelers occur due to infectious diseases. But other than that, road traffic accidents, heart diseases, okay, are also common. Okay. But those are not things that we can essentially prevent. But infectious diseases are something that we can definitely prevent by giving people the correct vaccination or by giving people the correct chemoprophylaxis. So what is chemoprophylaxis? Chemoprophylaxis is the presumptive administration of drugs to people who are at risk of contracting a infectious disease. Okay, in the absence of disease has not occurred, but you are giving the drug to prevent the person from getting infected, isn't it? So what are the determinants of travelers' health? So many things. If the traveler is having some pre-existing health issues, the behavior of the travel, okay, where that person is going, whether they are going to a city or whether they are going to trek in the Himalayas or whether they are going to a forest, that will determine what kind of diseases they might have. Purpose of travel, whether it is an official tour, whether you are going on behalf of the WHO to investigate an outbreak or whether you are going as a tourist, that will determine your risk. The season and duration of the travel, we know for infectious diseases, they have seasonal trends. For example, for malaria, it has got a seasonal trend in many parts of this country. It's mostly a monsoon predominant disease for major parts of our country. Next, destination, the accommodation there, the kind of food hygiene there, the sanitation that is present there, and the mode of transport. Okay, we know that suddenly, suppose you are going for a trek. If you are from the sea level and you suddenly land for a Annapurna base camp trek, then you might have certain sicknesses known as high altitude. So what you need to know in traveler's medicine for your exam are two simple things. One is the basic things you will be able to write. If I ask you what are the precautions that travelers need to take, you will be able to write, isn't it? They need to be aware of what are the diseases that are there. They need to take adequate measures to protect themselves from waterborne illnesses and from airborne illnesses. They need to be carrying, if they are suffering from any chronic diseases, they need to be carrying a identity card which mentions what diseases. Suppose someone is diabetic, they travel to a foreign country, okay, they don't even speak that tongue, okay, so they need to be having some identity which mentions that okay, this is a diabetic, so that if they are found unconscious, people can detect that they are probably having a hypoglycemic attack. Okay, so things like that are generic things. You'll be able to write them even if you do not read it in detail. But what you need to know specifically is what are the important travel vaccines and chemoprophylaxis for malaria. Okay, these are two things that are commonly asked. Okay, So what are the travel vaccines? Most importantly, so hepatitis A, as we know, one of the most common foodborne viral illnesses that occur, hepatitis A. And it can lead to significant severity in different people, especially if they have some liver disease from before. Okay, so hepatitis A vaccine is recommended for travelers visiting developing countries, right? Next is meningococcal meningitis, as I was telling you that it's prevalent in Saudi Arabia during the Hajj pilgrimage and also in sub-Saharan Africa. So there meningococcal vaccines ACY and W135. You know that this vaccine is also given to patients who have splenectomy, isn't it? Because once you are removing the spleen, people cannot protect themselves against capsulated organisms, isn't it? So meningococcal vaccine needs to be given to travelers who are traveling to those areas, Saudi Arabia and sub-Saharan Africa. Next, yellow fever. So again, sub-Saharan Africa, isn't it? So there are countries where if you're going to look at those, wildebeest migration into that, jungles of Kenya and Nigeria, then you must take the yellow fever vaccine. Okay. Next is Japanese encephalitis. Okay. Another disease now we are having in India also. Before, Japanese encephalitis vaccine was not given in all states of India because Japanese encephalitis is not prevalent in all states of India. But Asian countries, especially Thailand, Indonesia, Bali, they are having Japanese encephalitis. So people traveling, if they are not vaccinated against Japanese encephalitis, they must take vaccine against that disease. Rabies. So if you are going for forest trails and treks in tropical countries, we know that wild animals, they can be carriers of rabies. Okay. So a vaccination, prophylactic vaccination against rabies is also recommended. Okay. India constitutes almost 1/4 of the total global burden of rabies. Okay. So if someone is coming from, say, outside country to our country, it's reasonable for them to be vaccinated against rabies, right? Because again, it's a disease that causes 100% mortality. If someone gets it, they will die. There is no other alternative. Next, chemoprophylaxis for malaria. Okay. As we know that there are different regimes. Common ones are the one with chloroquine and mefloquine and doxycycline. Okay. Doxycycline, it is usually used for short term going. Okay. Because doxycycline is something that you need to give on a daily basis. Okay. The person has to take the dose daily, 1 capsule daily. So if someone is traveling for a short period, shorter than a month, then the prophylaxis is with doxycycline. But if people are traveling for a longer period, then it is not good to give doxycycline, then we go for chloroquine or mefloquine. Okay, drugs which are given weekly. They are given weekly. So with this I will end. Okay.